Good evening to everybody. I hope we are doing very good. Hello. Can they hear my voice? Good evening.
Good evening, sir.
Okay, at least I'm comfortable knowing that somebody can hear me. So let's give ourselves 3 minutes so that the others can join us. We have only 25 people here. Yeah, so in 3 minutes time, we'll start the lecture. So in 3 minutes time, we'll start the lecture. Okay, so good evening to everybody. I can't seem to find your people. Okay, now we have 102 people here. That is good. We want to start. Where are the others? Solomon Kwam. Solomon Kwam.
Sir.
Where are your people?
Sir, I believe they are joining. Yeah, they are joining, but I'll put it in the class group so that everybody can see and join as soon as possible.
Okay. Let me share my screen and then we can start the lecture because we don't have much time like that. It's like most of your people are not around, and I don't know why they are not around.
So the course rep is calling, so they will join in a jiffy.
Okay. Okay. So we are starting a new topic, and hopefully it might be our last topic for the semester, because from the 1st of December, we are writing your exam. And so we can't, I would want to finish this topic today. It's not much, I think it's around 39 slides. And then the following week, I'll designate it for questions and answers. And if you need clarification and clarity on anything, I think I'll do that for you. So that is the whole idea here. Okay. So by the time I'm done with this lecture, I expect you to be able to distinguish or differentiate between neoplastic and non-neoplastic lesions, contrast benign from malignant tumors, describe methods and mechanisms of metastasis, and then list the etiologic factors in carcinogenesis, understand clinical effects of neoplasms, and then know the diagnostic modalities of cancers. Yeah, so that is by the time we are done, all these would have been touched on, and then you would have appreciated my storytelling very well. Okay, so we'll start with some definitions. And please, and then we'll talk about cancers. Yeah. Okay. So whenever we talk about tumors, we are literally trying to talk about what we call abnormal swelling. And here, any form of localized swelling can be considered as a tumor. Now, it's much more specific meaning, or it has now much more specific meaning, which we call neoplasm. So instead of just tumors, we refer to them now as neoplasm. And neoplasm simply means, the word neo means new, plasm means growth. And so we are talking about new growth. And interestingly, what you Please make sure that you have muted yourself. Somebody was just talking right now there. So just like I was saying, we are talking about new growth, but interestingly, with this particular kind of new growth, its growth exceeds the normal cell growth, and that is not all. They are uncoordinated and they persist even after the normal tissue replacement has gone on. And so when you have growth, remember that when we were talking about healing, we said that when we lose cells, the cells that are actually labile or stable cells, what will happen is that the remaining cells or the existing cells will go through the cell cycle to produce daughter cells. But remember that these cells, when they are replaced to a certain level, we expect growth inhibitors to be released. We expect that the growth will not exceed that were lost. But when you have them exceeding and uncoordinated, and then even the exceeding is in an excessive manner, right? And then it's so radical to the extent that it's uncoordinated in any form, then it tells you that you are looking at something quite of concern or something of concern. What I mean by something of concern is that then you are looking at a malignant tumor here or malignant neoplasm here. That is where the cancers come in. That is where the cancers come in, because when you are to consider the benign ones, they are a bit coordinated. And then at a point in time, you can look at the coordination and then something can be done about it. But the radicality with which the malignant neoplasms or tumors grow is far, far advanced than that of the benign tumors. Anyway, but that doesn't define what benign or what malignant tumors are. I'll actually come to that, please. So let's look at the features of neoplasms here. The one is that they are autonomous or relatively autonomous growth. That means that in terms of uncoordinated, they are not regulated by any form of inhibitor whatsoever. So it decides to itself, and then by itself it regulates its own growth. And so that is how with regards to its growth from any other system. And then the next point is that normally cells do not replicate unless they are stimulated by growth factors released in response to physiologic, pathologic, or reparative demands. And that is another thing. You can never have these growth occurring unless you have growth factors, which are proteins. You have growth factors, which are proteins. So when you have these growth factors, that is when the whole replication thing can come in. Yeah. Okay. And then cellular replication is regulated by growth regulatory mechanisms. So as to whether this growth has gotten to its limit or has gotten to how far it should get to, you have growth inhibitors helping with that regulation. So if, let's say, there is replacement of cells as in healing, and then we just, for example, needed about 50 cells there. We needed like 50 cells there, right? We needed like 50 cells there. And then at the end of the day, you are having like 55, 60, 70. That's just an example. What will happen is that the growth inhibitors will be released to ensure that there isn't excessive productions of these cells. And that is where the regulation comes in here. The growth factors would ensure that growth factors would ensure that there are replacements from lost cells, but then growth inhibitors would ensure that the quantity of cells that are needed to replace the lost cells are enough, and then we have not exceeded the needed cells. Okay, that is where the regulation comes in here. And tumor cells called the neoplastic cells escape permanently from these normal mechanisms by transformation. And so whatsoever mechanism by which these, where what we mean by transformation is that sometimes they are able to those kind of receptors on the surface of the cells which these ligands will bind to, and these proteins, which are growth inhibitors, will bind to send signals to the nucleus to prevent the replication. They ensure that they are ineffective. Those receptors on the surfaces are ineffective. That is not all. The proteins that are needed for the inhibition, they ensure that they are produced in lesser quantities or they are not even produced at all. That's how it is. And so bear in mind that by the transformation,
Sir, please, your network is not good.
He is out of the classroom.
Oh.
Yeah, because of his network.
Hello.
Hi, sir. Welcome back.
Hi. What happened?
Welcome back.
Thank you. Well, what happened?
Your line was breaking. I think your network is very, very bad.
We could not hear anything, sir.
Let me bring it back and then I think we can sort things out. Don't worry, you'll be okay. I'm trying to share, so just bear with me. Can you see the screen?
Yes, sir. We can see it now, sir.
Can you see the screen, please?
Yes, sir.
Yes, sir.
Okay. Let me touch on what I was talking about the other. Yeah, the last. A minute. Okay. Okay, so I was talking about the transformation. I said that you have neoplastic cells or tumor cells undergoing some changes or some drastic changes as a result of genetic alterations or mutations. And I said that these transformations play to their advantage. And what I mean by play to their advantage is they are able to escape phagocytic cells and they are not destroyed because of such transformations, because the phagocytic cells sees them as harmless cells and normal cells of the body, even though they are causing damage to the body. And I made mention of the fact that the advantage also is that they are able to escape all forms of regulatory mechanisms whatsoever. And so if it decides to replicate and produce daughter cells, an increase in nothing can prevent it. Nothing can prevent it. Nothing can prevent it. And it's able to prevent any form of regulation by ensuring that the proteins which are responsible for growth inhibition are not produced, or they are produced in lesser quantities. And then even when they are produced, their effect, as in sending signals by binding to receptors on the surface of the cells. And then when they bind to the receptors, the signals will be sent down to the nucleus so that whatever instruction it has received to ensure that it produces daughter cells or it undergoes growth would be halted. It will prevent that. And whilst it is preventing the proteins that are responsible for regulation from being produced and from exerting its signals to the nucleus, what happens also is that it continues to produce growth factors to ensure that the growth keeps on whilst it is preventing the regulation.
Recording in progress.
And that is what I was talking about. So we are looking at the types of Yusuf Ruai. People have just unmuted their audios and it's even disturbing. Please mute yourself. Yusuf Ruai, please mute yourself. Yusuf. Okay. So just like I was talking about, I said we have benign and then we have malignant neoplasm. And we are going to look at some features of the benign neoplasm. And it starts with the first point being that a tumor whose clinical and biologic behavior are considered relatively innocuous or innocent. And so when you consider cells of such tumor as in benign tumors or benign neoplasm, you will see that the cells have not invaded the basement membrane and they have not caused any form of harm to the body yet. The word is yet. And so the clinical as well as the biologic behaviors are considered innocent because it has not caused any form of harm yet. And then will remain localized without invading surrounding tissues. So it doesn't spread to any other cell or any other tissue or any other organ anywhere. You won't find that happening. And then it is amendable by surgical excision. And so when such situations occur, what we can do is simple. You can go and see the surgeon, and then they can easily just remove such tumors from there because they have not spread yet. They are mostly localized at one point of the body, and you find out that it will have what we call capsules around them, this thin sheet that is around it. And that wouldn't be all. If you are to harvest these cells, or if you are to harvest benign neoplasm, as in cells that make up benign neoplasm or make up such tumor, and you observe them under the mic after processing and staining, they are not different from the parent cell from which these cells grew from or increased from or replicated from. Please bear that in mind. They are not different from, they have resemblance, they look exactly like the cells that they replicated from. Their parent cell or their original cells. So that is it. Please, if you have any question, you can ask. That is not all. Even though we are praising benign tumors, we are talking about the fact that they are okay and they don't cause any clinical problems and all that. The challenge with it is that when it grows bigger, because the fact that it's benign doesn't mean that it can't grow bigger. The difference between the benign and the malignant ones, malignant neoplasm, is its ability to invade the basement membrane and then spread. We consider the malignant tumors, they easily invade the basement membrane, what we call able to spread or metastasize to distant organs and distant tissues. So please, benign tumor, when it grows bigger, it can exist.
Hello, sir. Please, we can't hear
Hello.
you. Hi.
They looks like the network. It's like the network is punishing me.
So the voice was breaking, so I didn't get what you were explaining.
Let me try again and see. Can you please see the screen?
Yes, sir.
Yes, sir, we can see.
And
Yes, sir, we can
I think
see.
my voice.
But please, if you
I
can.
think my voice is a bit clearer now.
Yes.
Yes,
Clear. If you can go over.
I will definitely go over it, don't worry. Okay, so let me touch on the last point here. I was talking about benign tumors. I was talking about benign tumors, and I said that the last part is that benign tumors may cause clinical problems due to pressure on adjacent tissue. And I said that benign tumors can grow bigger. And when they grow bigger, they might exert their weight on some arteries and some veins, and that will prevent the flow or the spread of, the flow of blood from one organ to another or from one point to another. And so it is not advisable for it to grow extremely big or to grow very big. And that is why there is the suggestion of some excision that can be done or some surgery that can be done to just remove whatever has else increasing in number there. And so remember that you can visit the hospital, see the surgeon, and then they will easily extract such benign tumors, because if you don't extract it, it has the capacity to transform to become malignant. There were some tumors that were benign initially or earlier on, before the people knew it became malignant. Before the people knew it became malignant. So it's always better to just have surgery so that they just remove it. And then we come down to the malignant neoplasm. And here we are talking about a tumor which can invade and destroy surrounding tissues. Talking about a tumor which, and that is not all, but has the potential to spread or metastasize to other tissues or organs distant to the one which benign tumors or benign neoplasm from malignant neoplasm. The fact that in malignant neoplasm, easily it tries to set or the thought that it will try and then give roots spread. So that, and when we are talking about neoplasm, which is malignant, the public knows that as cancer. So as cancer. And I always advise my students that it is never advisable to talk about a client or the results of a client at the nurse's table, because unless you are
Again.
hello.
Hi.
Hi.
Today, what is happening?
Today, your network is very bad.
So we are just losing your voice.
Okay.
The voice,
What will happen is this. Let me try for the last time. If it happens again, I think I'll have to call off the class, and then we will do it next week, because we still have next week for which we can do the lecture. I don't know why the network is misbehaving that way. I don't know why it's misbehaving, but that's unfortunate. Okay. Okay. Can we go on?
Yes, sir. Yeah. Yes, sir. Yes, sir.
Okay. So I was talking about the fact that when we talk of malignant neoplasm, right, that is what is referred to by the public as cancer. And I think I said it earlier on. And I was giving an instance where some two nurses sitting by the nurses' table or station were talking about a client's pathology reports. And they were not smarter enough to know that the people can hear them. And so they ended up instead of using some pathological terminologies like the malignant neoplasm, which is not common to the populace or the public, they just went on to use the word cancer. And the person whose report had been brought overheard them talk about it. And whatever follows was an eyesore. If you were there, you pity whatever happened there. The person was wailing and crying, all because we're saying. And so, knowing that the populace or the public knows malignant neoplasm as cancer, when you are discussing a report which has to do with some tumor that was extracted from somebody, please make sure that you use the appropriate terminologies. And then it's even not advisable to have such discussions around your nurse's table anyway. And so you have malignant tumors, and these ones, they are typically rapidly growing. They are poorly circumscribed, and this is because of its invasiveness. The fact that it's always attempting to break the basement membrane and to spread immediately. They are not circumscribed. They are not at one place like the benign tumors, which has capsules around them. This is not like that. And it has this creeping attitude of it, which we call crab-like, right? And so that invading nature of it brings what we call crab-like appearance, or gives what we call a crab-like appearance. And that word crab-like is what we know as cancer, which the word cancer is a Latin word. Okay. Histologically, if we are to consider the parent cell from which they were harvested from, they are not anywhere in resemblance to the parent cell. They are not in resemblance to the parent cell, especially when it is a malignant tumor that has lasted for a while and has undergone the various transformations. Then you know very well that you look at it and then you try to see if you can relate it to the organ from which you took such cells from, and it's not even anywhere closer to those organs. What I mean is that if it has to do with a malignant tumor of the liver, when we extract such cells from there, and then we view under the mic, we must see some resemblance to the original liver. It tells us that something is wrong. Okay, so invasion of walls of blood vessels and lymph to produce what we call a secondary tumor or metastasis. So when it invades the basement membrane and it spreads easily, what we will see is that at the end of the day, it will form another tumor at a distant portion of the body. So let's say tumor of the liver, malignant tumor of the liver. When it begins to spread, it can go and form tumor of the brain, or even get down to other organs far from the liver. Yeah, that is what we are talking about here. So and then when it forms such tumor, that if that is the secondary tumor, then the initial tumor from which cells spread from is known as the primary tumor, secondary malignant tumor, or the secondary tumor. One key thing you find is that because of its invasive nature, it causes what we call ulcerations, and that would lead to the person bleeding as well. And please note that that condition of widespread metastasis is known as the carcinomatosis. Carcinomatosis is a condition of widespread metastasis. And so more than an organ, then we are looking at widespread metastasis here, where you are looking at a condition known as carcinomatosis. The clinical problems that malignant tumor cause is enormous, but I've listed few of them here. The fact that it can also grow bigger, just like the benign tumor, and it will exert the weight on adjacent organs as well as vessels. It can spread or metastasize to other tumors as well, or other organs, as well. And then based on the ulceration and the invasiveness of it, it can break vessels, it can tear tissues, it can ulcerate tissues and all that, and it will lead to bleeding, blood loss here and there. And then it can also obstruct flow because of its size. If it grows within blood vessels, it can serve as a blockade to the flow of blood. It can also grow bigger, and as a result of exerting its weight, it can prevent the flow of it can lead to the production of hormones. And so
Sir, please, are you there?
It's not that the thing is still breaking.
The network is very bad, and we can't apprehend anything.
okay, we might have to end the lecture. Is that?
So your voice is breaking.
Yeah, I know. The problem is that the network is not helping. So I think that maybe we'll have to make it next week, God willing. We'll have to have the lecture next week, God willing.
But sir, it's okay now. We can hear you clearly now.
Because the way the network is behaving.
So it will go back again. Say it again.
It's as even gone back. Today,
Okay.
It has
Network
started
is not helping
breaking
at all.
again.
So what will happen is this. God willing, next week, we have next week before your revision week. So next week, I'll finish up on it. Let me just end here because I think that it will be unfair also. Next week, God willing, I'll continue and then hopefully finish up. Okay, so thank you very much for coming to class today. We only did just some few, I think an hour.
Okay, sir.
I will try our best to read through so that when we meet you, just explain it for us.
Thank you very much, sir. We're most grateful.
I can't hear whoever is speaking. We can't hear you.
Yeah, I say we will try our best to read it, and if we have any explanation, then when you come, we'll ask you.
I mean, next week we will still meet. So don't worry. Next week you can read. Next week I'll continue from where I ended.
Okay, sir. Thank you very much.
Thank you. I have it. Thank you.